Dr. Richards, how does genetic testing and the results impact the treatment of a patient's ovarian cancer?
Dr. Lee, I'm really happy that you asked this question because I think what we've seen over the last 5 to 6 years is that genetic testing for women with a new diagnosis of ovarian cancer is of the utmost importance. There's a new line of therapies that have been developed called PARP inhibitors, P-A-R-P. And PARP inhibitors are drugs that have been shown to shut down one of the DNA repair mechanisms within ovarian cancer cells. And if we know that a patient harbors a mutation, a genetic mutation for ovarian cancer, as you had mentioned before, the HRD deficiencies or the BRCA mutations, we know that these patients do much better when treated with a PARP inhibitor in both a frontline setting from a maintenance standpoint, as well as a second line maintenance therapy for those patients. And so when we look at of an ovarian cancer patient and we know their genetic testing results, then we can look to see whether or not they potentially would benefit from the addition of one of these PARP inhibitors after their frontline treatment. And we've seen that what this has done is it's improved our progression-free survival. In other words, our time to when the cancer comes back, and it's improved it significantly. And obviously, when we treat a woman with ovarian cancer, I think Dr. Lee and I both agree that we want to do our best to try to make the cancer never come back. But unfortunately, a lot of ovarian cancer is found at a later stage. And so anything that we can do to delay the return of this ovarian cancer, these are important things that can benefit patients. It's time away from our chemo infusion centers. It's literally time away from our offices. And it gives those women time to spend with their families and then enjoy their lives and watch their family members grow, get married, have new babies born into their families. I think these are important things. And so when I see a patient with ovarian cancer, a new diagnosis of ovarian cancer, or I hear of someone through one of my colleagues who's diagnosed with it, I think that testing almost immediately upon that diagnosis, as you said, is very important because we can start with our initial treatments discussing what are some potential benefits that we would have of adding these maintenance PARP inhibitors on after the initial frontline therapy.